Let me say which student. Okay, Dr. Sadav, you are going to do this scenario. You have 1 minute to read. Are you listening? Hello? I cannot listen you.
Hello,
Yeah,
can you listen me?
yeah. No, I can listen you. This is the 1 minute reading time, and then 6 minute is your like speaking time. Then you will be like doing this station. Okay.
Okay.
Yes,
Should I
you can
start?
start. You can start.
Hello, I'm Dr. Sadaf, one of the doctor working here in A&E. Could you please confirm your name and age?
Well, I am Mrs. Maria Louis, and I'm 45 years old.
Hello, Maria. Nice to meet you. How
Yeah.
can I help you today?
Doc, actually, I'm having like chest pain.
Oh, it's must be uh, distressing for you. Could you please grade the pain when one is no pain and
It
10
is
for the
it,
most
it
severe
is
pain?
7 out of 10.
Okay. So, are you comfortable to talk at the moment?
Yeah, I can talk. I can talk. Thank you.
Okay, Maria. Can I call you Maria?
Yeah. You can call me Mari, no problem. But do
Okay,
something
thank you.
for me.
Thank you. Okay, Maria, as you said that you have chest pain, could you please tell me more about your chest pain?
Yeah, actually, it's a few hours back when I was sitting down, and it started suddenly, and like it's getting worse, and it's like always there.
Oh, and anything else you want to add?
Like what, doc?
Could you please tell me the site exactly where you're having pain right now?
It is down the center of my chest.
Okay, and what type of pain it is? Could you describe it for me?
Yeah, it is like something like very much stabbing pain.
Okay, and is there anything that making it worse?
Yeah, breathing. When I breathe, it's getting worse.
Oh, it must be distressing for you. And please tell me anything that relieves the pain.
No, doc, I haven't taken anything for this. Like when I sit down, I feel a bit better, but pain is always there.
Okay. Apart from the pain, do you have anything else?
Yeah, I can't breathe well.
Okay. Um, please tell me more about it.
Doc, actually, it started along with the pain, and I'm having problem, difficulty in breathing as well, and it's having the same way the pain has started.
Okay, and since it started, has it changed or it is the same?
No, it's. I think it's increasing a bit, but it's along with the pain.
Okay, and is there anything that making it worse?
No, I don't think so.
Okay, and is there anything that make it better?
No,
Okay, Maria. Could you please tell me, do you have fever or flu-like illness in the recent past?
no, not really.
Okay, do you have pain in your lower limbs, legs?
No.
Okay, and few things regarding your past history. Do you have such type of episode in past before?
No, no, this is the first time this has happened.
Okay, and have you ever been diagnosed with any medical condition?
Yeah, yeah. I am having diabetes.
Okay, and how it is managed?
Like I'm managing it like at per GP advice. I'm taking the metformin.
Okay, and apart from diabetes, any other condition?
No, not really, not.
Okay, so apart from diabetes medicine, what other medicine you are taking?
Yeah, I'm taking OCPs for the contraception
Okay, and since how long you have been taken?
for the last 2 years.
Okay, and could you please tell me any allergies?
No, not really. 2 minutes left. Hello. I cannot
Hello?
listen. Hello. Hello. Can you people listen?
Hello,
Yeah, yeah. I'm listening. I'm
call
listening.
is coming and okay.
Okay.
Okay,
Yeah.
so could you please tell me about any allergies?
No.
Okay, and now a few questions regarding your periods. Are they regular?
Yeah, they are regular.
And is there any chance you can be pregnant?
No, I don't know, but like my last period, menstrual period was 3 weeks ago.
Okay, and you are taking oral contraceptive pills for contraception. Is that
Yeah.
right?
Yeah.
Okay, and okay, please tell me, is there any travel history?
No,
Have you traveled recently abroad?
no, not really.
Okay, and a few questions regarding your sexual history as it's the part of the management. Are you sexually active?
Yeah,
Okay, and do you have a stable relationship?
yeah, I have.
And how many kids do you have?
Um, like I have 2 kids.
Okay, Maria, is there any, what do you do for living?
Like I'm housewife.
Okay, and how's your whom you are living with?
I live with my kids and with my husband.
Okay, is everything fine at home?
Yeah, everything is fine.
Okay, is there any other thing which I'm missing and it's important you would like to tell me?
Yeah, doc. Actually, you have not asked about the because I want to tell you that I had a breast surgery like 2 years ago
Okay,
because I had the
okay.
breast cancer at the time.
Oh, and how is going that now?
That's fine. I'm all right with that.
Okay, okay, Maria. Thanks for being patient to answering all my questions. Now I will like to do your examination. I will check your observation, and I would like to do the chest examination as well as I will auscultate the heart as well. Is that okay with you?
Yeah, saturation is 90, temperature is 110. Sorry, pulse rate is 110, and BP is 120 by 80. Everything is normal on the ABG's respiratory alkalosis.
Okay, okay, Maria. As do you have any idea what you can have?
No, really not.
Okay, Maria, which the history you've told me, and as you told me that you are taking OCPs, okay, oral contraceptive pills, and you had a breast surgery in the past as well, and you are having chest pain and breathlessness at the moment, and we have examined you and check your ABGs and check your oxygen saturation, and it is down like it is 90. So I think you are having. We are suspecting you to have a condition called pulmonary embolism. Do you know about it?
Yeah, no, I don't know really. Is this something very serious?
Uh, yes, it could be serious, but we will start the treatment immediately. And to start the treatment, we have to admit you in the hospital. Is there any issue with that?
No, really no issue. But do whatever you need to do is and do that quickly because
Okay,
treatment.
okay. Okay, Maria, we are going to admit you at the moment, and we will do certain investigations as well, which includes your routine blood investigation and your ABGs as well. As we have done ABGs, but we will do dimers as well to diagnose this condition. Okay, and we will give you oxygen just to make you better
Okay.
as you are feeling breathless, and we will give you painkiller, and I will inform my senior as well, and they will come and examine you, and they will we will review the investigation together, and uh, we will start anticoagulant as well. Is there anything you would like to ask?
No, thank you very much.
Okay, and meanwhile, if you feel more pain or you feel more breathless, please do. This is a button, and you can press it, and we will come to you immediately. And meanwhile, we are sending an investigation and start your treatment.
Okay. Thank
Okay.
you very much. Your time is up. Time is actually more, and you are doing well. That's why I let you to do because it's like 9 minutes now. It's 9 minutes. Okay.
Okay. Thank you.
Okay, students. Now your turn. Anybody want to add? Because anybody voluntarily want to add. Otherwise, I can pick anybody of you because I think you want to add something and you want to comment on this because it was very nicely done. For me, it was very nicely done. I will tell my remarks before anybody of you want to add anything. Okay. Any shortcoming? Okay, it was really very much composed, but I want you to add anything.
Yeah.
Okay. Yes, Zainab,
Can
you
I
want
go?
to add?
Okay, Zanat, yeah.
I felt like the history was very disorganized. It could have been more properly organized and the properly ruling in and ruling out of differential diagnosis.
For example, what
For
you
and
for example you
uh,
want to add what?
as in also no need to sign posting it every minute, so I need to ask a few more questions, I need to ask a few more questions. And other than that, there were detailed history at points where it was not needed, like the sexual history part and the kids part and the family history and everything. It could have been skipped.
Yeah. I agree with that, but regarding the point of disorganized, I'm not agree because you are
Yes.
saying that the second two parts I really agree that she should not have signpost too much, and some history could be like skip you are telling about, but
Yeah.
regarding the differentials, which thing you think that was missing? For me, like most of the things she covered, but I want to know.
Like the PMA Holy Family, if it was very disorganized, very abrupt, but like not following the order that we are following, like our approach.
No. For example, she started with I don't think so because she has been very organized regarding that. And for example, if we go from the Desert, we why we have organized in the same way. The problem is that we cannot ask differential questions in the history, but we can skip. We can like exchange like a drug with alcohol with smoking. We can exchange them. It can be any of that, but we can the disorganized history is called, for example, if a person is asking question, he's saying like you are having any shortness of breath, you are having any fever, are you a smoker, do you have any stable partner? This is disorganized. Then you again jump backward. She's not doing that. I think the history was quite composed. We have ordered because why we have made this order? Because we do not skip anything. That's why it is order. For example, we have made this order PMA Holy Family because she had not asked about the operation. That's why I need to tell that because always they do not tell. For example, if she had skipped already any operation, I could have skipped by myself, but I am happy because she have asked in the end, is there anything missing? Okay, if examiner want to tell, examiner can tell, but examiner don't want to tell, so still she has asked that.
Yeah.
Okay,
Can I add something?
yeah.
Yeah, she was very good. I think it was organized. There was no problem in this. I don't think so. It was disorganized. I think she should have asked like chest pain questions, a bit like any rash on the chest, any have you hurt yourself on the chest. It could be asked to rule out something from the chest pain. And I think there was some time management. Otherwise, her questions were completed. Like she asked everything regarding the pulmonary embolism, and I think so. And the sexual history, I think it was it could be skipped. Yeah, the sexual history and smoking could be skipped because it was an emergency case. So if the patient is in emergency, so we can skip it. I think the other things you better know, Dr. Hamid. Thank you.
Okay, anybody else want to add anything? Otherwise, I will ask Dr. Sadaf to, she should comment
This
as
is
well.
a case of emergency. Should we ask about the saturation? As patient is telling she has a shortness of breath. Should we go for saturation first or
No, I don't think
continue
so.
with the history?
Because, for example, if it is not, the monitor is not there, you cannot go for the saturation because you need to do the saturation. You need to do some test. So you will be asking that in the test part. Because if the monitor is there, it is the sim, and then you will go for the saturation. Otherwise, you cannot check the saturation in this way.
Okay.
Anybody else?
I think she missed
Dr.
the differential of myocardial infarction. That was important. Differential of the chest pain, and I think she did not ask about the family history too. If I'm missing that.
Exactly. This was important. This was important part she has missed, and this is important. She should not have missed the family part because she has been in the other part more, because that the family history part was important, because she should have asked that, and she had missed all also the part of the operation, hospital admission and operation, because I told her by myself, she has not asked that. Both of these were missing. You're right. Dr. Sadaf, you want to add anything? Like,
Yes, I do appreciate all the points which fellows are giving, and yes, I forget family history and I forgot surgical history as well, and I forgot at the end investigation to line up them. But yeah, it as we are in the early phases, so we make mistakes and we learn from our mistakes. So it was good experience.
okay, no, really, it was the one of the brilliant experience. Let me tell you, this station is 100% pass station, because we should set some standard so you people know about what are the standard. This is 100% pass station, because even though she has missed something, I have given her the clue and she managed that well, because because of that, if she had like her data gathering is like 2 out of 4, her clinical management is like 2 out of 4, and her interpersonal is almost 2 out of 4. Anything out of that could be 3 out of 4 as well, because her score, exact score, is 6 to 7 in this station. And for me, this is really a pass station, and I really appreciate this. For example, for me, she has done a practice, because I can see in a clearly, because regarding her grips part, everything was appropriate. And when she started about taking the history, she has asked the open-ended question, and you could you see, I told her many things together. And this is why you need to start your station. Start of the station, you should like ask a lot of questions to the patient. Let her speak, let the patient speak. You do not ask close-ended questions in the start, otherwise you get stuck in, and you need to ask a lot of questions. So you need to act in that way, that the patient speak a lot in the start. You should get the idea what's going on, and that's how you can do it. Ask open-ended question in the start. That's it. And I'm impressed that she have asked anything missing, because mostly when we are doing the station, we think that everything is done. We do not ask, and we do the blender. And that was even the good question. And regarding the management part, it was also All right. However, the management part was a bit disorganized. Dr. Sadav, your management part was, your data gathering for me, it was quite organized. In the management, what I have taught to the students, what is your role? Just state that before. You have
What
started
I
stating.
think,
Okay, let me complete. I will give it to you.
okay.
Just start with that. After disclosing the diagnosis, the patient is saying that do something. So what you could have done for me was the giving me the oxygen, then giving me the we put on the anticoagulant at once, and then we involve the senior, and then we will do, and CTPA. I think you have missed the CTPA as well. That you said that the D dimer, but D dimer is not that important. The CTPA is
Yeah.
important, because if we do the D dimer, it is if we have the suspicion of not having. For example, if D dimer come negative, will you not go for the CTPA? You will go for the CTPA. However, if you have the suspicion either it is yes or not, then we do the D dimer. If D dimer comes negative, because it has the negative predictive value, but it has not any positive predictive value. So you will say the CTPA. For me, your management part was, you knew everything, but it was not organized, because first you say whatever is your domain. After that, you involve the senior and you do the special test. That was the disorganized for me. Now your turn. You can say anything you want to add. Dr. Sadhu, you were speaking, or anybody else who was speaking? Like I said, let me explain.
Dr. Hamid, can I add something if you want?
Yeah, you can add.
I might be wrong. You're my senior, but here I'm working in the same system, NHS. So if they have a specific pathway of chest, like pulmonary embolism, if the D dimer is negative, they will never go to the CTPA, and they will not use their resources. I have tried a lot before. I have seen a lot of patients of pulmonary embolism. So I might be wrong.
But I need to tell you, because I need to tell you regarding the NIC guideline, because the practices on the different regions are different. So in the exam, we cannot say that it is common. What we can say, what is the NICE guideline or the NHS guideline. So a NICE guideline in this regard says that D dimer, if it comes negative, even the symptoms are there, then even then we are going for the CTPA. Because the patient safety is our concern, because because sometimes, because it actually, we do the well score in exact situation. What we do is the well score, and if the well score is, I think, the 3 or less or 2 or less, then we go for the D dimer. This is the standard. But here you need to, because it's a very obvious case, you need to tell the CTPA. You can say the D dimers as well, no problem with that. Even if you do the D dimer and CTPA, that's all right. But if you do the D dimer and don't say any thing like CTPA, that is blunder.
Yeah, well score. Yeah, I got it. Yeah.
Exactly. For example, one thing is, because we are discussing it, because it is important, we need to quantify as well, and CTP is to quantify. For example, if the patient is having, we are going a bit away from our what is our exam, but let me tell you, for example, if the patient is having the hypotensive and it is the massive infarct over there, what you need to do is you need to intervene. You can use altiplase, rectiplase. That's what we need to do the CTPA.
Yeah, got it. Yeah, thank you.
Dr. Sadar, you want to add anything? Because it was your station, and really, I really appreciate that. Was brilliantly done.
Thank you. Thank you. Actually, I am so scared about performing and doing mocks in groups, but it was good.
No, really
nice
good.
Experience.
No, don't be scared. Everybody is sportive here. Nobody should be scared here, because we want all of you to pass this exam and to join for NHS, because everybody is sportive here. Nobody should be scared here. Okay, next, go to the next scenario. Dr. Mariam, it's you who are going to do the next scenario.